Well, we continue to listen very closely to what our medical experts are saying about this pandemic. And so this week, we want to bring you more of our interviews with two experts we spoke with last week, including Dr. Deborah Birx from the White House Coronavirus Task Force. She made news last week telling me she would welcome a role in the Biden administration and that she thinks the transition team should indeed get access to the task force and its data. That process could soon be moving forward. We also spoke about the sharply rising case numbers here and across the country. How do we turn these rising case numbers around?
Well, the good news is we know exactly what to do because we've handled this in the South. The South looked like Indiana in July, and they put in mask mandates. They told people to physically distance. They told them to practice good personal hygiene, but most importantly, they told them to limit gatherings to their immediate household only, because every single gathering can become a spreading event because the level of asymptomatic spread, where the person coming into your house, whether they're your aunt, your uncle, your cousin, your niece, could be infected and spreading the virus unknowingly.
And you can find that entire interview on our website. Just click on In Focus. But right now, here's more of my interview with former State Health Commissioner Dr. Judy Monroe.
Everybody's got pandemic fatigue. We totally get that. It's holidays. Everybody wants to be with family. And yet with these surging numbers, the only way to turn it around right now, before we have the vaccine available, which is coming, we really need everybody to follow all the advice in terms of washing their hands and keeping their distance, but particularly wearing a mask and avoiding crowds. And so when it comes to the holidays, it's just really important that folks not travel and alter their plans and keep it small.
So just about all the states bordering Indiana have taken aggressive new actions in recent days, adding some new restrictions. Our state has not gone quite to that extent yet. Do you think more needs to be done in that regard?
Well, it may. It really does depend on how these numbers. I know in Indiana, the hospitals are pretty overwhelmed right now, and we really have to think about the hospital staff, particularly. You don't want to overrun your hospitals. And so there might be a need for more aggressive. I applaud the governor. He's really modeling. I know he's in quarantine right now, and, he has had the mask mandate. And so that's all really, really positive.
Does there need to be a different approach generally across the country instead of a state-by-state pattern?
Well, I think consistent messaging is really important, right? Because we don't want to confuse the public. And I think that's coming out stronger now with more governors having the mask mandates and so forth. But it's really, when you have a pandemic, the virus doesn't care. The virus doesn't care what political party you're with. They don't care what time of the year it is. It will seize upon the wintertime when everybody's indoors. And so we are facing this really critical time right now between now and the vaccine. The winter months are upon us. So I do think we need to have consistency in messaging. We need our data. Data is super important because we are a large country. So what one state is able to do in terms of being open may look different from another state. Although right now, the whole country is facing a lot of virus, a lot of viral spread.
How hopeful are you for 2021 that we can turn things around and that these vaccines, obviously some really good news about the vaccines here in recent weeks, that they can indeed make a difference at some point here next year?
I applaud the science. I mean, it is remarkable what's happened in 2020 in terms of innovation and scientific discovery. And so the fact that we have 2 vaccines and more on the way, but the efficacy of these 2 vaccines is fantastic. There's a lot of planning that needs to take place at the local level, at the state, and then the local level to make sure that shots get in arms, because vaccines they're terrific, but only if they actually get in the arms of people and folks trust that the vaccine is safe. But I'm optimistic. I think 2021, we should be able to turn things around if we all work collectively and follow the science.
You served as state health commissioner under Governor Daniels here in Indiana at a time when people may not have known the name of every state health commissioner as they do now across these 50 states. What are your thoughts for Dr. Box and the many other health commissioners who now have the job you once held here as they navigate this health crisis?
Yeah, I've been in contact with a lot of health officers in my position at the CDC Foundation and supporting CDC, and first of all, my hat's off to them. They really are my heroes. All the health departments and and all the clinical workers in the hospitals as well. I mean, this has not been easy. And it's been so long. I mean, during H1N1, that was a pandemic, but we didn't face what they're facing today. One of the things that's been really upsetting to me has been some of the backlash against our health officers. I mean, they have all become household names, I think, in each of their states. And but there's been backlash, and they really are trying to be public servants and get the message out. I mean, what they care about is saving lives and keeping people healthy. And the more that everybody follows the guidance and the behaviors, that's how we keep our economy open. It's not an either or. I mean, we can keep things open, but folks need to wear those masks and keep the distance, and we have to be vigilant.
And can we, broadly speaking, kind of navigate that divide that exists? Because as you mentioned, there's a backlash sometimes. People have strong feelings one way or the other. Perhaps they're not well informed on the situation. How do we bridge that gap so that people have that kind of awareness that's critical to getting through this until the vaccines are available for everyone?
That's a terrific question. We've actually been working on that at the CDC Foundation with other partners, working with community-based organizations. I think it comes down to trusted messengers. And so those that resist wearing a mask, or we've even had across the country people that don't even believe the virus is real, even after they're critically sick themselves. I think the messenger matters, and I think they need to hear from their trusted community leaders. So that's why I've told a lot of folks, everybody has an opportunity to help with this in terms of the trust in their spheres of influence.
Dr. Judy Monroe, former state health commissioner, with us. Coming up next this Sunday in Focus, President-elect Biden making more cabinet nominations. We'll talk with our panel about the incoming administration and the potential Indiana impact. Then later, one state lawmaker proposing big changes to the way we conduct our elections in Indiana. Stick around. We'll be right back.